plan to meet the health problems of the population in that particular community where you are going to be assigned. And sabi nga ni Maglaya, ay sabi nga ni Professor Luz Barbara Dones, who wrote chapter 7, no, from the book of Maglaya about planning, no, planning for community health nursing programs and services. Sabi niya, when as the community health nurse plans to meet the health problems and needs of the population, there are 4 basic questions that are asked. No, and this is actually, she is just actually echoing also what Dr. Mercado has suggested in terms of public health nursing. So, what are these questions? Una muna is, where are we now? Pangalawa, where do we want to go? Pangatlo, how do we get there? And pang-apat, how do we know we are there? So, in layman's term, kumbaga, when you talk with the members of the community, no, these are the same 4 basic questions that we're going to share with them. Kasi, di ba, when we go to the community, we are not there to resolve their problems. No, we're not the ones who's going to, to resolve their problems. We will be working with them so they can resolve their problems. No, we will help them, we will assist them, we will facilitate things so that they can improve their state of health and they can improve the level of health, no, of their families and the community as a whole. So, yun yung sinabi ni Dr. Mercado, which is actually those 4 questions, in simple terms, they are basically the 4 steps ng planning cycle that Professor Dones has mentioned, no, in the book of Maglaya. So, sabi niya, ang step 1 doon ay yung situational analysis. So, ano ba yung situational analysis? It actually just answers the question, where are we now? And situational analysis is kung ano ang ginagawa natin sa community diagnosis. We are analyzing the situation, no, of the community. So before we can do that, to be able to do the situational analysis, to be able to study, no, the situation of the community through conducting a community study or the community assessment or the community diagnosis, we need to collect data. And after collecting that data, we need to synthesize those data. And after synthesizing those data, we need to analyze them, and then we interpret, no, the information that we have gathered in a manner that will provide a clear picture, no, of the health status of the community. So again, we collect, we synthesize, we analyze, and then we interpret. So, and that is basically what you did doon sa first and second activity, di ba? Meron na tayong available na data, di ba? And then all you have to do is now to find meaning, no, in that data set that we were able to gather. No? So, nandun na ang case. But remember again, next year, in your actual community immersion, kayo ang gagawa ng data na yan. I mean, kayo ang magpe-present ng data na yan. And before you can present that particular data, you will need to conduct data gathering. You need to collect data. And you need to synthesize those data into a meaningful data set. No? And then, of course, analyze it and then interpret. So, kumbaga ngayon, inano na natin yung collecting tsaka yung synthesizing. Kumbaga, yung sa skills laboratory natin, what you already have is the collected and the synthesized data. And what you're going to do is just analyze and interpret those information. So, bakit natin ina-analyze at bakit natin ini-interpret? Because it will guide us, no, in identifying appropriately the problems, no, of the community. And when we talk about problem identification in the community, there are mainly 3 categories, diba, of data. Of problems that you need to be able to identify. Yung nature ng problem in the community are health status problems, tapos meron yung health resources related problems, health resources problems o kaya at ang health-related problems. So, in the lecture of Dr. Delgado, she mentioned to you about, or she discussed those three categories of health problems. Diba? So ano-ano ba yung mga health status problems na yan? Yung unang category ng data. Diba? Actually, the health status problems, which is the first category of data, are actually parang kumbaga yung mga health deficits natin ng family health nursing. Kaya lang, ngayon sa community health nursing 2, ang ating health status problems are actually described in terms of increased or decreased morbidity, increased or decreased mortality, fertility, or reduced capability for wellness. Ano yung mga yun? Ano yung mortality? Again, and morbidity. Diba? Sabi natin, mortality are actually the number of deaths. And morbidity naman refers to the illnesses, to the cases. So, when we say hypertension, when we identify hypertension as a health status problem, we know very well na hindi lang enough na na-identify natin na merong may hypertension. What we need to find out is mga ilan in that particular barangay ang may hypertension. Bakit natin kailangan malaman kung ilan o ilang percent ng community ang may hypertension? So that when we design the health program, the health intervention, that will be the basis kumbaga of our evaluation kung effective ang ating So our goals and objectives now will focus more on, is it decreasing the number of cases, or kaya for example, measles, yan, upper respiratory tract infection. So we're not just talking about the health deficits about upper respiratory tract infection. We're talking about the incidence, the number of cases, the number of new cases, and also the number of old cases combined, So yung mga ganon, yung incidence rate, prevalence rate, of these diseases. So yan, kumbaga yung health status problems of the community, yung mga health deficits na yan, ang kumbaga premise ng utak natin ngayon is yung community as a whole, ilan sa kanila ang may upper respiratory tract infection, who are affected, children ba, meron bang elderly, lalo na ngayon na may COVID, ilan yung children na naapektuhan, ilan yung may elderly, ilan yung may young adult, etc. So that we will be able to analyze very well their problems. So that's the health status problem category. Another category is the health resources problem. So, and the health resources problem may be described in terms of the lack or the absence of manpower, money, materials, whether it is institutional, those provided by the government or the state, or even those resources that that involves private sector or non-government organizations. So, meron bang problema about health resources problems? And another category is the health-related problems naman, which are actually described in terms of the existence of social, economic, environmental, and political factors. So, kung titignan mo yung categories of data doon sa community diagnosis, yung demographic profile, yung health and illness patterns, yung mortality rates doon, morbidity rates, yan, doon ka makakita ng mga health status problems, pag kapag yung second category na social, economic, and cultural variables, nandun yung ating social indicators, economic indicators, pati yung environmental factors, pati yung political and leadership patterns kasama doon sa health related problems. So tatlo, health status, health resources, health related. So So yun. So yun ang kailangan nating ma-identify after na ma-analyze at ma-interpret natin yung data that we have gathered doon sa community assessment. Pero yun nga, para ma-facilitate no, yung problem identification and explanation, no, we need to develop a problem tree. So, because the problem tree can actually lead us to the probable causes of the health status problems. So, like for example, merong incidence ng parasitism, no? Or high incidence of parasitism in that barangay, maybe in Wawa, no? In Sitio Wawa. So, incidence of parasitism, pwede nating, so sa objective cues natin dyan, kung ilan ang may intestinal parasites doon or ilan yung target para ma-target, magkaroon tayo ng target population para sa deworming. So kailangan natin ma-identify sino yung may mga symptoms o kaya those who are at risk for intestinal parasitism or those who have reported na meron nga silang intestinal parasites. So that is the health status problem, high incidence of intestinal parasitism. Now, if we are going to analyze that problem, we can say that high incidence of intestinal parasitism may actually be related to health resources problems, no? Or kaya health-related problems. Ano yung mga health resources problems at health-related problems na yan? Pwedeng yung low level of education, pwede ring lack of basic health facilities, no? Walang deworming program doon sa barangay, hindi sila naaabot. Tapos also there are unsanitary waste disposal system, no? Which is a health related problem, diba? Kasi as poor child care, no, walang nag-aalaga dun sa bata. Nagtatrabaho yung parehas na magulang, naiiwan lang dun sa katulong. Tapos hinahayaan lang yung bata magkakaukaw doon sa lupa. Tapos isusubo. So yon. What else? Poverty, that grinding poverty, no, in the community. So as you analyze the problem, no, of the community, then you can identify, no, the causes and also the effects of that core problem, no? So yun nga, in that example, ang ating core problem ay high incidence of intestinal parasitism. So aside from the causes, no, yun nga, sabi natin related yun maybe that is related to yun nga, the health related, kumbaga that is associated with the health related problems and health resources problems. Aside from that, we can also identify the implications, no? So what are the health implications? So kung mayroong high incidence ng intestinal parasitism, ano pa yung mga pwedeng outcome naman nun from that core problem? So para kang gumagawa ng diagram ngayon, you are ng contextual map, no? Using the arrows, the arrows pointing to the subsequent effect, no, of that possible cause. So para kang gumagawa ng pathophysiology. Now, paano nakakatulong yung problem tree? It helps us it helps us analyze the situation ng ating client, process their their situation, mentally process the possible factors, the probable causes ng kanilang health problem. Bakit? Paanong makakatulong sa atin ang problem tree? So we can sufficiently plan for interventions. Na baka akala natin kapag ginawa natin to, magpurga lang, tapos na yung problema ng high incidence of intestinal parasitism. Pero pag tinignan natin yung problem tree, hindi lang naman pala lack of deworming program. Pag inanalyze pala natin doon sa problem tree, lumabas kasi hindi lang naman lack of yung sa deworming program, hindi sila naabot, kundi may low level of education. Hindi naiintindihan ng nag-aalaga doon sa bata yung kahalagahan ng yung kahalagahan ng pag-aalaga dun sa bata, so they will not develop intestinal parasites. So, kung titignan natin ay so yun nga, so hindi lang pala deworming activities ang kailangan para ma-resolve yung high incidence of intestinal parasitism. Kasi kung lumalabas dun sa problem tree na meron din about low level of education, maybe kailangan natin ng information drive, para naman doon sa mga nag-aalaga sa mga bata. Tapos, also some negative attitude of health providers. Yan, pwede natin rin i-address. So, how do we address this negative attitude? So, and what is the reason why they have this negative attitude towards the health providers? Tapos preoccupation with earning a living. So both parents are working, iniwan lang sa katulong. Yung katulong man, hindi masyadong nakikita ang kahalagahan ng good hygiene among the kids. So, yun nga, yung hindi nabuhugas ng kamay. Diba? Yung mga reason kaya nagkakaroon ng bulate yung mga bata. Diba? Yung kamay, kung saan magkakakaukaw, tapos susubo ng pagkain. Kung hindi mabilis yung nag-aalaga, so wala na. Lagi na lang. Kumbaga, yung mga mikrobyo at kung ano-ano pa na isusubo ng bata. Okay, so, yun. The problem tree helps us identify, kumbaga, other related problems as we continue to analyze, as we try to identify problems that are related to the core problem. So, parang nagiging tree siya. Okay? So, yun nga. So, basically, the situational analysis, or how we analyze the situation of the people in the community involves 3 activities. Yun nga, yung pag-gather natin ng data so that we can describe the health status of the community. And when we discuss the health status of the community, syempre, yun nga, we describe the community as a people, as a place, as a social system, etc. And then second, after gathering the data, the nurse identifies and explains the problem, the problem. So, it's not enough that you formulate. So, kailangan nag-formulate ka. Sandali, paano nga pala kayo mag-formulate? So, again, you will use the typology. Pero, yung typology kasi na ginamit natin last year is about, 4 yung nature ng problem natin dun, di ba? Naalala ninyo? Ano-ano yung mga yon? Yung foreseeable crisis, wellness condition, health deficit, at saka health threat. 4. Yung nature ng health problem, nursing problem sa family health nursing. Pero ngayon ang community health nursing, 3 yung category ng problem, yung nature ng problem that we're dealing with. The health status, health resources, tsaka health-related problems. Pero, kumbaga, yung mga specific problem ID, problem identification na ginawa natin doon using the typology, those are actually the same. Ang kailangan lang, you need to identify those specific problems, saan siya magpo-fall. Will it fall under the health-related problem? Will it fall under the health resources problem? Or will it fall under the health status problem? So, yun yung tatlong yun. So, for example, improper garbage disposal. So, saan ba yun lalabas? No? So, health-related problem. Another example, increasing cases or increasing incidence of hypertension. O, saan yun natin ilalagay? Hindi natin siya i-identify na health deficit, kundi the increasing incidence of hypertension as a health status problem. Diba? So, yun. So, makikita nyo naman. So, once you are able to identify these problems, then explain these problems and their interrelatedness, using the problem key. And then last, the step is the nurse projects what situations needs to be changed, developed, or maintained. So, we describe the community as a people. We describe the community as a place. We describe the community as a social system. Now, we decide with the community, alin doon ang i-maintain, alin doon ang kailangan i-improve, at alin doon ang kailangan na mapalitan. Okay? So, yon. And, of course, after that, pag nagawa na natin yon, di ba, ang susunod na question is, ang una kasi, ano pa lang yun? Parang, where are we now? Ang susunod na question, according to the planning cycle discussed by Professor Dones, ay ang where do we want to go? So, when we answer the question, where do we want to go, then we basically formulate our goals and objectives. No, the goals and objectives of what? Our goals and objectives with the community, for us health programs. Our goals and objectives of the health programs and nursing services that we're going to provide. So, nursing services that we're going to provide for what? What is the purpose? Basically, to change, or to improve, or to maintain. Diba? Yun nga yung tatlong yun eh. Either to change, to maintain, or to improve, or develop. So, pag tinignan natin ang purpose, why we are there in the community, again, tandaan niyo, tatlo lang. I repeat again, i-maintain mo ba yung descriptions na nadatnan mo? Kasi pwedeng maganda yung pagdating mo. So, kailangan magkaroon ng intervention para ma-maintain yun. Otherwise, baka mag-backslide. Diba? Or it could also be nadatnan mo. Ito yung status ng community. Pangit, kailangan baguhin. So, another intervention. Baguhin. To what extent? As in 180 degrees turn? Yung mga ganon. Or to what extent? To what degree? Ang changes that we're going to work on. So, change. And another is develop. So, develop. Improve. Ano improve natin? So, doon lalabas ngayon yung mga percentage. Ilang percentage ng population ang affected. Diba yung sa ating ranking? Diba? Yung scoring natin doon, kapag 75 to 100 ang population na affected ng ganito. So, this is how we are going to prioritize this problem. So, kaya kailangan natin yan because they will become the basis, kumbaga, of our goals and objectives, of our reason for staying in the community. Okay? So, the goals and objectives will serve as a guide, for our efforts. Para hindi tayo nawawala, hindi tayo nadidistract. Meron tayong rason bakit nandun. At kahit mahirap, hahawakan mo yung goals and objectives mo na yun. Hindi ka pwede pang mag-give up kasi meron ka pang goals and objectives. Diba? Ganun sa community. Okay? Unless mag-end contract. Diba? Unless ma-reassign ka. But hanggat nandyan ka, diyan ka naka-assign, then you will always go back to your goals and objectives. So, of course, I will not be discussing about goals and objectives now because Sir Nemi already had a very exhaustive discussion about that. Pero siguro example na lang, like sa health problem. Kanina we mentioned about the high incidence and the prevalence of intestinal parasitism among children. So ano yung magiging goal natin doon? The example, ang magiging goal natin doon is, since may high incidence, then our goal is to reduce, reduce the incidence and prevalence of intestinal parasitism among children of sitio Kamatsu, or about sitio or wawa, etc. So reduce. That's goal. That is broad. Napansin nyo, hindi specific. Paano reduce? To what extent ang pagre-reduce? Papasok ngayon dun sa objectives. 75% of children below 6 years old will test negative for parasites after 1 year. So again, 75%. Another objective would be 80% of households will have access to safe waste disposal system within 6 months. Okay. Third objective would be 80% of households will have access to safe and adequate water supply within 6 months. And then another example is 75% of children under 6 years old will have regular clinic visits. So saan natin binis yung mga objectives na yan? Babalik tayo dun sa problem 3. Diba? Yung mga probable causes of that core problem. We need to address yan. So yan ang ating magiging springboard to develop our objectives. Because anyway, they are the ones causing this problem. They're the probable causes of the problem. Kaya, we are aiming na yun nga, may regular clinic visits. 75% at least of the children, under 6 years old will have the regular clinic visits. So that's one objective. Also, sa problem 3, lumabas yung water supply. Dahil doon, kaya yung hindi siya safe at hindi rin adequate. Kaya nagkaroon ng high incidence of intestinal parasitism. So what are we going to do? I-increase ang number of households that will have access to that safe, and adequate water supply within 6 months. So meron kang time frame, meron kang way to measure your progress. Okay? So again, yun. Minsan, you're at a loss. Ano ng objective ko? Paano itong mariresolve ang problema? Ang babalikan mo yung problem 3 mo. Analysis. Okay? So yun. And then you strategize. You strategize. Paano? To answer the question, how do we get there? So again, yung kanina, where are we now? Paano masasagot yan? Through the community diagnosis, through the situational analysis, through the problem 3 analysis. Tapos, ano yung susunod? Where do we want to go? So, goals and objectives. And then, how do we get there? That's strategic planning, or strategize and activity setting. So, it basically, yun na yung next na step na gagawin ninyo dapat. Yun na yung sa implementation. Yun na yung you will develop now the program. Kasi you will strategize now. Dapat doon sa program na yon, sa project proposal mo, sa training design mo, kailangan klarado kung paano mong mamimit yung mga goals and objectives. So, klarado dapat ang steps. Klarado dapat ang mga resources na kailangan, yung patutunguhan, and also clear din ang evaluation metrics mo. Yung mga evaluation indicators mo of the progress. Okay, so, yan. Actually, marami pa in terms of evaluation. Pero again, hindi ko na rin yan i-discuss specifically. Kasi si Sir Nemi at si Ma'am Teresa Linda also has a very exhaustive discussion rin dyan. So what I really want for you to have, to leave with you in this session is yung simplicity of taking care of the community. You don't need to be overwhelmed. Kailangan lang, alam mo yung mga patutunguhan mo. Alam mo yung kailangan mong makuha na data. Alam mo kung anong gagawin mo sa mga data na yon. Alam mo how you're going to analyze those data, and the problem 3 will be able to help you. And of course, when in terms of analysis, hindi ka naman mag-analyze at gagawa ng diagram on your own. Diba? Ang magiging guide mo para makagawa ka ng diagram ng matino is also your reading, no? The literatures. Parang yung pathophysiology, pag gumagawa ka, hindi ka naman makakagawa ng pathophysiology on your own without your knowledge of the anatomy and physiology. And also, without the knowledge of pathology, no, of the abnormality, no, that is going on, or the abnormal functioning that is happening because of certain abnormality in structure. So, yun. Kaya ka lang makakagawa ng pathophysiological diagram because you have an understanding of those concepts already. So, in the same manner, na ganun din sa problem tree analysis. Yung mga problems na yan sa community, kailangan din nating maintindihan. And so, we continue to do research. We continue to read, find adequate literatures that will help us understand. No? Ano yung mga dapat na hanapin na literatures? Related studies. No, related studies that were previously conducted because they will provide us rich source, no, of information that will help you, that will guide you in your decision making. Para makapag-decide ka na, ito pala ay probable cause. Ito pala ay possible health implication because of this core problem. Did you get it? No. So, yun. Yun nga, magkakaiba man minsan ng terms at magkakaiba man minsan ng format, pero iisa lang naman yung storya, diba, ng pag-aalaga sa pasyente, sa kliyente. Diba? We always go by the steps of assessment, diagnosis, planning, implementation, intervention. It's just that nakukomplicate lang kasi magkakaiba ang characteristics ng client natin. Na nung una, individual, tapos naging family, tapos ngayon population groups, and the whole community. Okay? So, if hindi mo pa ganong gamay, no, the differences, then befriend Maglaya. I hope that you will continue to read, no, because Dr. Araceli Maglaya actually has given us, no, a very good methodology, no, on how to take care of the community. Although of course meron namang ibang framework that we can use. Pero Dr. Maglaya already, the reason why we have been using the framework that is suggested or by Dr. Maglaya and her associates, no, it's because it presents a very thorough methodology, a very thorough framework, no, na nakaangkla doon lahat ng planning steps natin, lahat ng mga strategies natin in taking care, in rendering healthcare, no, to the community and its people. Okay? So, yun nga, as I've said, I will not be discussing yung specific details kasi nandun naman sa lecture, di ba? Ni Sir Nemi at ni Ma'am Teres, especially yung kay Sir Nemi, yung sa training design and project design. So maybe what I will just ask from you is if you happen to experience a difficulty, no, in doing the training design and the project proposal, feel free to message me. Okay? Kasi yan na naman. Pagdating sa training design, pagdating sa project proposal, may different format yan eh. Pero ang kailangan lang naman dyan be simple. Kailangan alam mo yung gusto mong mangyari. At alam mo, nakaklarado na nakalagay paano mong gagawin yon. Okay? And syempre kasama dyan yung time frame. Diba? Yung Gantt chart ninyo. No? Para yung pagta-target. Yan. So, yeah, I really wanted to have a face-to-face interaction na with everybody. Iba pa rin, di ba? Kasi mabilis mag-troubleshoot. Unlike ngayon, I'm just recording this session. But I hope that this helps kahit papano. Okay, and